On Thursday, 37 Medicine X attendees participated in the IDEO Design Challenge. Their goal? To be part of a design process that puts patients at the center of innovation. The day started at IDEO's design headquarters in the heart of downtown Palo Alto. Dennis Boyle, a founding partner at IDEO, gave us a tour of the cutting-edge campus where designers work to find the next big idea. Boyle and his team are using product development strategies to tackle healthcare problems.
Design thinking seems to be valuable in almost any problem that needs innovation.
And on Thursday, Medicine X participants were invited to be part of the action.
How much work and effort and experience you had.
Although most had no design background, the participants had rich experience in the healthcare field.
I'm a fifth-year general surgery resident up at UCSF.
I am the co-founder of a startup that is called Trace Health.
So this is where participants break into 5 groups, each led by an IDEO designer, to hear problems presented by the e-patients and start to strategize design solutions.
So why can't you have a doctor do that? Why can't you have someone that maybe is somewhat more experienced kind of come to the home?
I just wanted to know where you guys are in the design process. What's been happening so far?
Yeah, so right now we're getting into some brainstorming of ideas, but also understanding the systems involved.
The point of the day is to be inspired by their first-hand experiences.
I like seeing all the physicians that are participating, but they're not leading. It's the patients who everybody is focusing on.
The teams then used the patients' first-hand experiences and problems and decided as a group which issues they wanted to tackle.
My 4 problems that I brought to the group, we kind of realized all had a core theme and kind of a core idea. And as we were talking, we realized we were centering in on this other idea, and we said, this is what we got to work on.
This mini design boot camp was interspersed with wisdom from Boyle. First up was a session on brainstorming, where participants were encouraged to let their imaginations run wild and limit negative thoughts. Post-its piled up as the day got rolling, and patients and healthcare professionals worked side by side to create innovative, creative solutions. They were guided in the process by their IDEO team leaders and encouraged to use design thinking.
I just helped them kind of pull their ideas out and get it into a great story.
The day concluded with a presentation from each group illustrating their problem and their idea to solve it. Some groups got really creative.
Doctor, I'm not feeling well, and I seem to have lost all my hair.
It was a learning experience for all.
I think there were a lot of interesting insights from all the different kind of stakeholders in the group, especially as the other patients have said what the doctors are experiencing. So, you know, I learned a lot.
So my favorite part today was getting to sit with so many different people from different disciplines in healthcare, and that the ideas that they brought to the table, because I never really get a chance to sit down with them and say, these are my problems, these are what we need solved, how can you help me, what is your advice? And kind of that give and take of information was really valuable today.
At the end of the day, it was all about human-centered innovation, a perfect way to kick off Medicine X 2013.
I've been to a lot of conferences, but Medicine X seems to be very unique and just almost radically putting the patient in the center of the process.